in the ways that will keep everybody safe look like. And we're heavy into that work now. That will take us through at least a couple of weeks to even get our plans together. And we'll look forward to then hearing from the province how they see this rolling out and working in concert with that advice.
Well, Paul, thank you very much. Do appreciate that update. And we alluded to our special guest that's here this evening. And over the coming weeks, as we continue to respond to the COVID-19 emergency here in Hamilton, we will be inviting special guests to attend our virtual town halls. And the guests will help us answer the questions that we're seeing on Twitter and, of course, receiving at www.hamilton.ca/askcovidquestions. And as I mentioned, it is Ken Leandhurst. He is the city's Director of Licensing and Bylaw Services. Ken, thank you so much for joining us this evening. Perhaps we could start with a brief summary of the work your municipal law enforcement team is doing right now during this COVID-19 emergency.
Well, thanks, Mike, and thanks for the opportunity to come on. A team's been very busy, and since the emergency was called by the province, what our team has been doing is we've prioritized the work that we traditionally do in bylaw enforcement, and we've focused our attention in on COVID-related incidents. And certainly the province came out with legislation that closed a lot of businesses and made certain businesses essential, but they also closed a lot of the amenities that are around the city, but also in private locations. And so a lot of our work has been making sure that these properties and amenities are closed. And so we've been going around checking all the playground equipment that has been closed by our Parks Department, over 340 playgrounds within the city of Hamilton. But baseball diamonds and golf courses and tennis courts and basketball courts and skateboard parks and fitness equipment and those favorite picnic areas and bench areas, those are all closed by the province. And of course, you know, we have our traditional places in Hamilton that have always caused us issues, which are like Albion Falls and the Devil's Punch Bowl, well as our emergency control group also closed the waterfront trail, which we saw a great amount of people there. So a lot of the work has been doing is enforcing the closures and making sure that people are actually behaving themselves.
It's a wonderful update. Thank you very much for that, Ken. And I know we have a number of other questions coming your way this evening. It's now my pleasure to introduce back here to the program Mayor Fred Eisenberger. It has been a long day of Zoom calls with council chambers. Mr. Mayor, thank you very much for joining us. And today, you and City Council participated in their fourth completely virtual council meeting. Some of the questions that we have received lately on Twitter has to do with how residents can continue to provide feedback during these virtual meetings. Would you mind speaking to that and perhaps highlight any COVID-19 related information coming out of council earlier today?
Okay, Mike, thank you. And can you hear me all right?
Loud and clear. You sound great.
Good. So thanks. Yes, I just finished the council meeting. I kind of ran over. Sorry I'm late. And we did deal with one matter from council. Just to remind everyone that members of council are continue to be available. Maybe not when they're meeting today, but certainly by email and by phone, as they always are, to deal with any issues out there in the broader community. And so, just a reminder of that. But today, I put forward a motion or advanced the motion that talked about the recovery of the Economic Recovery Task Force. Sorry, a little rattled here. I'll get myself organized. The Economic Recovery Task Force motion was approved, and it was really all about working towards helping businesses, industry, film industry, music industry, restaurants, and others when and if, or not if, when they're allowed to go back to some semblance of being open, that we are prepared with potentially the personal protective equipment that they might require, some spatial separation that they'll need to have, some help and assistance for them to navigate to being able to open up their businesses and get back to the work that they're accustomed to doing. That's not going to be an easy thing. There are many aspects of that that are going to be challenging, especially relative to the COVID recommendations. Obviously, financing issues based on the shutdown that we've had so far. A lot of those issues are going to come to the fore. And so we're hoping that this task force coming together will provide a pretty strong indicator of the kinds of things that they're going to need to be dealing with and how we can help them actually facilitate dealing with that through the announcements that have happened by the federal and provincial government. So I think that's a positive step forward. So we'll expect terms of reference. So it's not kicking off today. And as we well know, the Premier did not say that things are relaxing as of today, but we're getting ready for the eventuality that things are at some point going to relax based on the recommendations of public health provincially and locally. So that's a good step forward. And I think the terms of reference will indicate, I think, a strong team that can come together from all sectors to help in that recovery task.
Mr. Mayor, thank you very much for that. Dr. Richardson, another question has come in for you in regarding getting an update on how we are managing COVID-19 in our local long-term care homes.
Thanks, Mike. As you know, this is the setting where we're most concerned about some of our very vulnerable citizens, those that live in long-term care homes and retirement homes. And, we currently do have those 10 institutional outbreaks that are in long-term care homes and another 5 that are in similar sorts of settings. We're working with our health sector partners. So these are people from the long-term care homes themselves and the broader long-term care home retirement home sector, with our 2 hospital partners through St. Joseph's Hospital and Hamilton Health Sciences. And we're working as well with the inspectors from the Ministry of Long-Term Care and the Retirement Home Regulatory Authority to really look at each home and make sure we take our full understanding of it. And we get in touch with these homes either every day or every other day to see how they are doing. When they're in an outbreak, we're touching base with them every single day. When they're not in an outbreak, it's more like every other day to make sure that they're doing fine in terms of having the staff to be able to provide care, making sure they've got the PPE on hand, making sure that from the standpoint of infection control, that they're able to practice good practice. And so we are doing that with each of our long-term care facilities here in Hamilton. We're also moving forward with the surveillance testing that the ministry has asked us to do, the Premier's asked us to do. So if a home's in outbreak, we do a lot of testing around that particular outbreak situation, but we now have expanded that so that we test everybody in long-term care. And so we're moving through that. We're about 20%, 25% of the way through that. We're doing that over a couple of weeks. Of course, we have the outbreaks that are ongoing. So we're shifting back and forth between managing the outbreaks, between working with all of the settings to make sure they're prepared and doing that surveillance testing. So the plan is to complete that over the next week as we go forward. So if there are any homes in need, the partners pull together and are available to them to make sure that they can have additional staffing. Our hospitals are in particular, and home and community care are stepping up to provide that staffing if a home is feeling that they're not able to keep a safe staffing level in place. So they're doing well. We've, where there are challenges, we're able to meet them along with our partners, and hopefully we will continue to see that there's not a lot of further spread that happens in any of these homes, and that we will manage to continue to protect those that are living in these situations.
Of course, and thank you very much for that update regarding the local long-term care facilities. Paul, back over to you. Last week, the city announced the restart of some services like grass cutting and litter collection. Can you talk more to us about this and explain what it means for residents, please?
So thanks, Mike. There are some services that we're restarting in a modified way. COVID has hit us at a seasonal time of change, and in the city, there's a number of things that we want to keep on top of. We anticipate, of course, that we'll slowly start to evolve in the reopening of certain activities, and so we don't want to, for instance, not have maintenance in our parks, which can be a bit of a safety issue in its own right for people who use the parks. And there's other types of maintenance that we just want to keep on top of. So we looked in the last couple of weeks at ways that we could do some of those services in modified ways safely. So in some cases, for instance, it's a challenge. We had to think differently from our staffing perspective. We would normally pile 4 or 5 people into a truck and take everybody to the park and get out the equipment and cut some grass or do some of the maintenance there. Obviously, we don't want to bring those that many people together in a cab. So now how do we get everybody there separately. And we do have people that are reassigned to certain other jobs, so we don't always have our full complement. But things like some of the litter pickup that needs to happen along some of our right of ways and in the city, obviously some of the grass cutting in parks, we want to keep on top of that. And if we don't, as we start to move through May, and I look at the weather even for this weekend, we're going to get into some much warmer temperatures, and we've had a lot of rain. The growing will start in earnest, and we want to keep on top of it. It won't be the same level that people might have been seeing in the past. We're going to do the basics really in this modified way. So a few of those things are happening. It's little things like if we do believe that we're going to have a mum show in the fall, which is it happens in the fall, not anytime soon. We actually need to start to do a bit of horticulture work now. So those are the kinds of things where we're bringing in just a few people doing some of the work behind the scenes. From the public's perspective, what it means is they may see a few more workers out in the community. And this doesn't mean that everything is back to normal. It means that we're trying to do what we can to ensure that we keep on top of things at the City of Hamilton and not have either a situation where we can't get some of these assets back to where we want them to be, or everything is just a bit of a mess as we continue through this next few weeks. So a few things going on. It's really the behind the scenes stuff of keeping the city going well. It's a real credit to our operational departments who are finding ways to keep people safe, but do the work that we need to in the community. And as I came back from getting a few groceries today, I noticed that some of those crews were out there along the Lincoln Alexander Parkway doing some of that maintenance that we need to do along there. So I see some of this work already happening, and that's what the community will see in the coming weeks as well.
Wonderful. Thank you very much for that update, Paul. Greatly appreciated. Ken, we're going to head back over to you now. And a question has come in asking if you could please talk a bit more about the Emergency Measures and Civil Protections Act and what kind of charges we have seen under this act so far, and maybe highlight the areas where we see the most infractions.
Okay, thanks, Mike. Yeah, it's interesting because the provincial government enacted the Emergency Measures and Protection Act, which traditionally gives the authority to police officers to enforce. But they realized that the impact on policing was probably going to be significant. So for the first time that I know of, they actually empowered the municipal law enforcement officers or bylaw officers to enforce the act. And so our team has gone out there and with a focus on education and awareness, but have gone out there and started to enforce this act. I talked a little bit about places that are closed down, and but we're also checking for essential businesses to make sure they're operating correctly. We wanted to make sure that all the amenities were closed down, and unfortunately, we got to the point there that we had to start moving forward with charges, and just to ensure that we are getting compliance. And so far, our team has laid over 100 charges. 7 for businesses. We've charged 15 people for gathering for larger than a group of 5. We've got 63 people or 63 charges under the use amenities that are closed. We've actually charged 6 people for obstructing a municipal and law enforcement officer. And that was a new charge that the provincial government came out with and said, you have to give your identification to a municipal law enforcement officer. You must not obstruct their duties. And of course, we went to a couple house parties last weekend, and they were not that cooperative, and so they end up getting an additional $1,000 fine. And of course, we laid 7 charges for people using the dog parks that are actually closed. And I know later on I might talk about the physical distancing, but we have laid 2 charges under the physical distancing. Our hotspots continue to be Albion Falls. I mean, the people that are coming to Albion Falls are mostly out of towners, but they want to come and see Albion Falls. All our waterfalls are closed. If they're not owned by the city, they're owned by the Hamilton Conservation Authority, and they are closed and they're not to be added. But we've also found a lot of activity down at Battlefield Park, people having picnics, people using all the equipment. Shadok Golf Course, of course, has been a hot topic for us because people were using the escarpment stairs. And we found people all over Shadok Golf Course using it as a leash-free park. We found a couple that were actually treasure hunting on the fairway with metal detectors. And of course, we also found people having a round of golf. The waterfront trail continues to be something we're looking after. Devil's Punch Bowl has become a real hot area for us, as well as the Dundas Driving Park. And actually, talking to their team this morning, they said that probably the biggest area right now is the HAAA grounds. Lots of people using the grounds, but they're playing soccer games, they're using the equipment, and our officers are going to be there. And so it's okay. The parks are open, as Paul says, use the parks, but you can't use the amenities. And the provincial government did this on purpose, so that we could keep physical distancing and that we would not spread this virus around.
Ken, thank you very much for that update, and nice to hear that the majority of us are getting it, and thanks to your bylaw officers that are out there keeping people straight. Mr. Mayor, we're going to head back over to you now. Earlier this week, Premier Ford announced a framework for reopening Ontario, as you know, and are we developing something similar locally? What will it look like, and when can residents expect for things to return back to, I guess, the new normal? That's the question.
Well, that's a good question, Mike, and I don't think anyone has the immediate answer for that, but I think clearly the province is making some preparations for what reopening the province or municipalities looks like, and certainly the City of Hamilton is doing exactly the same with the help of our medical officer of health and our Emergency Operations Center. They're having a look at the provincial recommendations and the provincial Ontario Chief Medical Officer of Health and their recommendations to see how we can then apply that locally here to loosening or opening up the businesses and services and space and public spaces in our community. But as the Premier said, this is not this is how we do it, not necessarily when we do it. So that is still going to be directed by how we are in terms of the virus. What stage are we in? Have we flattened the curve, and have we seen multiple weeks of reduced cases to the degree that things that the medical officer of health can indicate that we can start to loosen things up? And I don't think we're there yet, so we're not ready to make that change. And then the question becomes, what does normal look like? And obviously it's not the normal that we're accustomed to prior to the shutdown of our services and prior to the virus coming to us. It's going to be a different kind of normal, bearing in mind that the virus is still going to be out there, and protections have to be put in place. And so, all the businesses, all the places that we will see public will likely still require, when we do open them up, physical separation. Businesses that are operating will still require personal protective equipment, possibly thermometers, to check people as they're coming into their establishments, and protections for not only the people that are coming in, but for their employees as they're operating in these environments. So it's going to be a very difficult, challenging process, much more difficult than closing the city down to protect the spread. It's going to be much more challenging than that, and will be guided by what the virus is doing and what public health is saying in terms of the safety of our loosening things up. What we don't want is to loosen things up too quickly and then have a spike in the virus count and put more people in hospital and potentially put more people at risk of dying as a result of this virus. So that's the worst case scenario that nobody wants to have happen. So a careful, methodical, strategic approach is how this is going to work, both provincially as well as locally.
Mr. Mayor, actually, just a quick follow-up question to that, if you don't mind, with businesses having to think of the new normal reopening with PPE. Mm-hmm. Is that something that they will have to endure as an expense on their own? Will it be covered? Has there been any discussion about that at all?
Well, there's discussion around that, and obviously the municipality is not in a position to provide protective equipment for all the businesses in our community. Demand for that is going to be actually quite significant. I would think that that is an area that both the province and the federal government are going to have to look at in terms of offsetting some of those costs. They're already offsetting rent costs, or already offsetting employee costs. If the cost to operate a business is so high that they can't continue to operate, that is a detriment to our economy. And so the issue of protective equipment and the needs that they're going to have to ensure that they have a safe work environment is going to have to be a factor of funding that the federal, provincial governments are going to have to consider. I think it's going to be a factor for sure. I don't have an answer for that. I think it's going to be an issue that we're going to continue to deal with, and we'll be raising that with both our federal and provincial partners.
Mr. Mayor, thank you very much. Now, Dr. Richardson, to kind of follow up on that and more from the medical side, this question is coming in from our web form. So when things do start to reopen here in Hamilton again, what should businesses expect, and how can they support the recovery here in Hamilton, again, from your perspective and what you see on a day-to-day basis?
Well, I think the first thing is to recognize that they have been doing yeoman's work already to support Hamilton, whether it's changing the way that people work and having people working from home, or it is unfortunately having to close down their business and understanding that it has to happen for a period of time. It's all the essential businesses that are still up and running and are providing services to all of us so that we can keep going. Our grocery stores, our auto mechanics. My car was in today because it had to go in. Our farmers who are helping to feed us. There's so many people that are out there working to make sure that we can continue on. And so as we move forward, for those businesses to think about, when can we get back to the usual, and when can we reopen and can we do things the same way? It unfortunately is not going to be business as usual in most cases. And we're going to need to continue to be innovative in the way that we work and the way that we carry forward. So those infection control practices, that physical distancing, the hand washing, the covering the cough, and very important to stay home when you're sick are important things that are going to have to go on as we go forward. The other things are that they're going to have to look at the ways that they do business. So working from home is going to continue to be a big part of what we do for some time to come yet. They're going to need to look at whether there's other ways that they could modify their business so that they can maintain that physical distancing. The good news is that the province is going to spend a lot of time over these next couple of weeks doing up more guidance for business. So we know a lot of small employers in particular, small businesses in particular, they don't have the occupational health and safety sort of experts in at their fingertips that some of the larger employers may have. And so the province is going to work up some more guidance to help people to understand what they can do, and we'll be there to support them in implementing that guidance. So it is going to be a stepwise fashion, and we'll need to learn as we go. Fortunately, we are learning from other jurisdictions as they begin to open up and have experience with what the implications are. We'll be watching very closely to see when we get to that point, and we are not at that point yet. We'll be very closely to see what the impacts are on the number of cases and the number of severe cases, and see whether we can continue to move forward or if we'll need to move back. We'll need to look at whether that happens very much on a regional basis, on a Hamilton basis, or is it a broader region in the south and the north is doing something a little bit differently. We'll need to be monitoring that as we go, and this is going to be for some time. If we're lucky, we'll have a vaccine developed in 18 to 24 months, or we'll discover some other treatment that can treat those very severe cases. But all of that is yet to be learned about this virus. So this is a new way of working. It's a much more complicated and new normal that we're going to have to figure out how to live within.
Maybe just a quick follow-up question to that as well, then, if you don't mind, Doctor, in regards to restaurants and some drive-throughs, the masks and the gloves that those people are wearing, some discussion, and I guess maybe management at the various locations has to look at deciding on how to properly dispose of those masks and gloves, or is it just something as simple as taking them off properly, throwing them in the garbage, washing your hands really well?
So really, when we're talking about that use, it is about taking them off properly. Taking gloves and masks on and off, putting them on and off is a bit of an art. We have to do it well because they can get contaminated on the outside. That is why we're wearing them after all. And so we need to make sure that they are taken off very carefully, and then they can be disposed of. They should go straight into the garbage sealed up, so that of course none of our waste collectors are exposed to them in the process, whether they're private industry or our own city waste collectors, and then they can go in the regular garbage. So they're there for people to use and stay safe, and luckily we can dispose of them fairly well. But it's the actual use of them and taking them on and off that needs to be very careful so that we don't inadvertently lead to spread.
Great. Thank you very much for that, Dr. Paul. We're going to head back over to you. Last week, the province announced that community gardens could reopen but our community gardens right here in Hamilton, they remain closed. Can you talk a bit about when residents can expect gardens here in Hamilton to reopen so they are able to get back into community gardens to get spring preparation work underway?
So very, very soon. In fact, our goal is in the next 2 days to have the guidelines out so that people can get ready for this weekend. We set a target as having those out, and we're well on the way. Public Health has done a great job. Saw a draft today of what the guidelines look like. We're just cleaning those up and finalizing them, and then they'll be out. So kudos to Elizabeth and her team for that work. And this is going to be a great opportunity for people to get access really to the fresh food that we need. And so, yes, community gardening is a great way to get outside and do something. But to be really clear, I think the main reason this has happened is it's a great source of fresh food. And we need to remember that that's critically important at this time. And for many folks, particularly those with low incomes, community gardens are provided to community organizations or provided directly to people who could really use it. So this is good news. The guidelines will be up on our website within the next day or two. And once they're up, what I would say in anticipation of them going up is that those organizers or the people in charge of those community gardens, you will have some work to do. So these guidelines will simply not be good to go. There'll be some specific things that need to happen by those who organize community gardens to ensure that everybody that goes there to do the work stays safe. And so, Mike, back to some of these other questions we've been having, things are not just business as usual. It's not us just taking the close sign off and saying, go at her again. This is going to be a little bit different. And people will have to take some precautions as well as doing some checking to make sure that everybody who comes and participates in that stays safe. So I think this is going to be an interesting window into some of the things that we may see in other types of activities. But I think we can confidently say that if people are okay to follow those guidelines and are able to do so in short order, that community gardening will be happening in very short order in the city of Hamilton.
Great, Paul. Thank you very much for that. And we do hope people continue to abide by the rules when they do come out. Looking forward to seeing those. Ken, we've touched on dog parks. So currently they are closed to the public. And you've mentioned that there have been some charges, as we've seen lately, and they've been related to people walking their dogs off leash in places where they shouldn't. Are people allowed to walk their dogs off leash right now? And if so, where should they do it?
Well, Mike, that's a great question because it seems to be uh, a lot of the work that my animal services team is doing. Now, since the dog parks are closed, people think that they can go to a school ground or a public park, or we've even had them on golf courses that they want to let their dog run free. And the responsible pet ownership bylaw says if you have your dog out anywhere in public, it must be on a leash. If you want to let your dog out, let it out in your backyard, or if you own a farm, let it out there. But if you are anywhere in the city of Hamilton and you have a dog, it has to be on a leash. Otherwise, it is an offense under this responsible pet ownership. Now, think about it. Everybody's in our parks right now. We have grandparents walking their kids, moms and dads walking their kids, and a dog comes running up to them. They don't know if it's a safe dog. They don't know. And you can hear the owner says, oh, he's friendly, but you don't know. And so for everyone's enjoyment, we're encouraging or we're telling them, you got to have your dog on a leash. It's the law. And we are enforcing that. And we're sending the message that make sure if you're going out with your dog, and lots of dogs are getting lots of walks right now, make sure it's on a leash.
Ken, maybe just so we can strike a little fear in these people, what is the fine if you don't abide by this law? What's the out-of-pocket expense?
Well, it's not as high as an emergency fine, which is around $880, but it's still a $100 fine. So it's an expensive walk to walk your dog, and it's one of those bylaws that we have educated and warned, and we've gone right to enforcement because, especially right now, the risk is so high for someone to get bit by a dog. We have over 100 dog bites a year that we investigate, and we just want to keep everyone safe, and that's why we are enforcing this bylaw.
Well, as a former police chief used to say on one of our shows that I was doing, compliance is free. So there you go.
Yes, it's true.
Mr. Mayor, back to you now. Each week, you do a great job of providing a summary of the supports available to our residents who may need help with their rent or bills or to keep their small business afloat. Can you once again please summarize those supports and again remind residents how they can go about accessing them, please?
Well, thank you, Mike. Very important information right now. So a lot of folks are, obviously wanting to apply to all of these supports that are out there, and hopefully many of them have applied already, and hopefully some of them have got, money into their accounts already. But if you're missing out on any of this, or you need information on any of those supports, whether it's a business or an individual, or if you're an EI or looking for the CERB benefit for the weekly amount of money for coming from the federal government. It's all on our website. So hamilton.ca/coronavirus. Visit that page, and all the financial supports that have been announced to date are updated on their daily, and they're all available to you there in those categories. I can tell you that just over the last week, the Business Continuity and Economic Recovery website has been kicked off with the three chambers of commerce participating in that, as well as at their hamiltonchamber.ca/COVID-19 site as well. The financial reliefs are available from all levels of government, and people that require assistance beyond the internet, and that we've run into this on a couple of occasions. They can call the Hamilton COVID-19 hotline at 905-974-9848. And there's an operator equipped with the necessary information on the other end of that line that can help residents get access to these financial assistance that are needed out there. I mean, I do want to compliment, the federal and provincial governments are stepping up in very, very big ways to help support individuals and businesses in our community. Unprecedented in every way that you can possibly imagine. But there is an application process that applies to all of them. So it takes some time to set that up, and it also takes some time to process that. So clearly, the information is available to residents in Hamilton, and if they go to that website, and again at hamilton.ca/coronavirus, all the information is available to them, and they can make the applications through that process as well. So I encourage everyone to take advantage of the supports that are out there. It's to help you stay in your home, pay your bills, do your groceries, or pay your rents. And that may not last forever, but it's certainly going to last us for over the next many months as we're working through dealing with this virus on an ongoing basis. So do take advantage. And again, you can call at 905-974-9848, and an operator on the line will help guide you to that level of assistance as well.
Mr. Mayor, thank you very much for that update and reminding us of that phone number. Dr. Richardson, back to you now. We have a question coming in from Twitter. Can you please tell us a bit more about the drive-through testing center that is now open here in Hamilton, and how does it work, and how does a resident go about getting tested there?
Thanks, Mike. The drive-through testing center has been a bit of a novelty for us all, I think, up at the Dave Andrzejczyk Mountain Arena on Hester Street. The setup is a single lane drive-through that goes in the arena through the Zamboni door. So a little bit of fun for those of us who've always wanted to go through that door, although there's no riding the actual Zamboni, of course, with the ice out. So it's open from 10 a.m. to 3 p.m. Every day of the week. It is the primary site really now for our referrals when they come in. So for any of the assessment centers, you do need to go through the public health line or through your family doctor to get referred to those sites. That means that people aren't waiting around a long time for their testing to be done, and we can keep people moving through and not having people gather there. And it does really allow us to get more people through in a more efficient way. At this point, we've completed 609 tests since the site opened a couple of weeks ago, and we're very thrilled about that. I think today I heard they were getting through about 1 every 3 minutes almost was where they were at in terms of having people seen at the site. Of course, if you don't drive, you can still be seen at one of the other sites, and there are special arrangements put in place if you're driving a diesel vehicle or that sort of thing, or if you have a large vehicle that can't go through that door, we can take care of you still at that site through different measures. So very thrilled that it's up and going. It's been a great site. It's going to be very important too as we go forward in our testing plans around long-term care and retirement homes. They'll play a significant role there too. So it's been a really good thing to have gotten together with our primary care partners, our hospital partners. The city has played a huge role, of course, with our facilities team and our rec group. So it's been a good site.
That's wonderful to hear. A nice good news story there as we continue through this new normal and look at flattening the curve. Paul, a question has come in from our web form. HSR has made a lot of changes recently in order to ensure physical distancing and, of course, safety for customers on the bus. Is there anything else planned, and how are the measures put in place already working to ensure safety of both the customers and the drivers?
Well, I want to start by commending both our operators of our transit system and those who rely on transit each and every day. I think everybody is trying to work together to get through this, and so the measures that have been put into place are working. There basically is no boarding through the front doors now, which creates a separation, no pass by of the driver. A little bit tough on the fare box side of things because it also means that transit is free now. So everybody's boarding through the rear. We've blocked off more seats behind our drivers. We've moved back the yellow line, the infamous yellow line, so that people know not to approach the operator. So all that keeps that physical separation. So it keeps our operators as safe as possible. The challenge moving forward for us, and particularly thinking ahead to our planning for reopening services, is as more services are open and more businesses are open, more people are going to need to take transit, both to get to businesses, but also to get to work. And so we've been able to greatly reduce the capacity on the buses. We've been limiting the number of people on buses, and that's going to change a little bit as we move forward. So we're going to have to think of additional measures, asking the public to take additional measures, as well as also looking at the configuration of the operator area and things on the bus so that we can continue to operate a transit system moving forward. Transit can't be delivered for free forever. So we're going to have to get back to a little bit of a normal within our transit system at some point, but we're going to have to do that in the safest possible way. So I can tell you right now, we're exploring all sorts of options that and working very collaboratively with both our frontline operators, because they know best what might work in terms of configuring the bus as well. And also with their union leadership and our management, so that we can continue to do what we need to do for transit. But I just want to say hats off to our transit users, and also thank them for their patience. We have a different level of service in transit at the moment so that we can maintain a consistent and predictable transit, but it's not at the normal level of service. And all of that is in the planning works as to how we can get back to A, a normal level of service, and B, make it the safest for both patrons and those who operate. What we don't want is a situation where actually the public doesn't feel safe taking public transit. So we talk a lot, and in the early stages, quite rightly, talked a lot about how do we protect our operators. That will continue to be a huge focus, but we also have to maintain trust in our public transit system. And it is an environment where it is difficult to say everybody will stay 2 meters apart from each other. That's just not possible with a high functioning transit system. And some of what will happen as things start to reopen. So all of that's on the table right now. The specifics will come out as we get closer towards some of these changes along the way. But the things that we put in place have worked quite well. And the best measure of that, Mike, is the fact that we did make that early on, as you know. You were on these town halls early on when we talked about that different level of service we were going to run Monday to Saturday. We've been able to maintain that. That has never differed. We've never dropped back on that. And in fact, at times when we know we have more riders along the line, we've added additional buses in those surge times. So we've been able to meet our goal, which was a reliable, predictable level of service, have done that extremely well. And thanks to the public for their patience, and also thanks to our HSR operators and management for the work they've done.
Paul, thank you very much for that update. Ken, we're going to head back over to you now in regards to how City Council recently passed a physical distancing bylaw. Can you tell us about this bylaw and what residents need to know? And can someone be fined for going for walks with their friends and neighbors that don't live under their roof?
Yeah, Mike, great question. I got to tell you, when the provincial government came out with their emergency orders, they strongly recommended the physical distancing of 2 meters. However, it wasn't enforceable, and through the leadership of the mayor, and our council, they decided to move forward with a bylaw that actually would force the issue to make people responsible to physical distance. And of course, it was unanimously passed, and we now have this bylaw in place that does make it an offense if you are not physically distancing against someone that doesn't live in your same building or same house. And so the question is, uh, can you be charged if you're walking down the street with your neighbor or your friend and you're not physically distancing? And the answer is yes. Now, we've always gone down the road of uh, looking for compliance, educate, create the awareness. And we spent a great deal of time after this bylaw was passed, making sure that people were aware that the bylaw was in fact in place and it was there for the protection of the, the, the people in the group, but as well as in the entire community, because we want to flatten the curve. We want to stop it. Unfortunately, not everybody is compliant. We have people that don't want to listen to the bylaw, and we also always have that enforcement option if education and awareness does not work, and then we can actually charge. And it is a $500 fine, and which is a pretty heavy duty fine. So it's easy. Walk with your friends, walk in the park, but keep your distance.
No, by all means. Again, pretty simple rules to follow. Mr. Mayor, we're going to head back to you now. The cost of COVID-19 locally, provincially, and federally is going to be incredible. Can you talk to us about some of the local initiatives the city is working on to prepare for the costs, given revenues for the city are limited at this time? And what are you doing to ensure the cost does not ultimately fall back to local taxpayers?
Yeah, very important question. And, folks might have noticed in the news the last week or so that the Federation of Canadian Municipalities and the big city mayors, we're one of 21 big city mayors across the country, actually made a pitch to the federal government that, across the country, that's likely on the short term going to require a $10 to $15 billion bailout to ensure that municipalities right across the country are going to fix this large revenue and additional cost hole that we're all experiencing at, varying degrees and varying different places. When we're, offering up free transit, and when we're putting people up in hotel rooms for the homeless or into the First Ontario Centre, we're providing housing supports, we're providing personal protective equipment, we're introducing testing sites at arenas. All of those costs come to bear on the local tax base. And as you well know, we're always making the argument that out of the $1 of the tax base that gets collected in the country, 50% goes to the federal government, 40% goes to the province, 10% stays locally in municipalities. And for that, we're expected to do a lot. Keep the water running, keep the roads in good shape, all of the services that we provide, including the culture and rec centers, which are now closed that we're not generating revenue from. And so our estimate in Hamilton is some currently to the end of May, some $25 million of revenue and expense shortfall that lands on the local tax base right now that is not sustainable for us. And we should not be allowed to run deficits as part of the solution to this, because that just exacerbates the problem. So as you know, we asked the federal government for a significant bailout for all municipalities, and for Hamilton, that would hopefully mean that on the short term, we're going to get potentially 25 to some $50 million covered in the financial shortfall that we expect we'll experience over the next 6 months. That's an issue not only in Hamilton, but in Toronto, the issue is almost $1 billion. And in places like Vancouver, it mirrors that as well. And it really is an added expense and lost revenues. And that nothing can make that up. We now have to go to either the tax base and to people that are already struggling to meet their bills. So you can rest assured that we're going to continue to pursue, and we've got positive response from our federal partners that this is something that they're going to consider.
Mr. Mayor, thank you very much for that. We're going to head over back to you, Dr. Richardson, as we have another question that's just come in from our web form. This is about the use of face masks. We have spoken about this before. but can you please talk to us a little bit more about face masks, and should residents be wearing them when they are out? Are they mandatory?
Thanks, Mike. They're not mandatory, but they are recommended. So wearing a non-medical face mask in the grocery store, on transit, anywhere where it's difficult to do the physical distancing, it's another measure that people can take to prevent the spread of COVID. So what a mask does is for those people who don't know that they're actually carrying COVID, that are asymptomatic, as we talk about, it gives an added protection by stopping those droplets from leaving that person and potentially infecting somebody else. They do also have some benefit for individuals in protecting them from droplets and preventing them from getting infected. So it is a way we can reduce our risk when we are out there. So it is recommended that people do that. It could be a contributor to helping to stop spread. And one of the things as we do move forward is we'll continue to look at the role of masks opening back up for business. And the bottom line, of course, is if you do have any symptoms, a mask is not the thing that you use to make it so that you can go outside. If you do have symptoms, you do need to stay home until those symptoms have resolved.
Doctor, thank you very much. Paul, we got a couple minutes here before we start to wrap things up. We have a question coming in regarding some protests and folks complaining that their freedoms and liberties have been taken away as a result of the closures and restrictions that the city and the province have put in place. Paul, what would you say to those people?
I'd say remember why we're doing this. I don't think there is a politician, certainly there's nobody on the staff team that I work each and every day that has been waiting for the moment that we can close down businesses, close down parks, keep people from doing the things that make this community vibrant and rich. No one got up wanting to do that. You heard the mayor talk about the amount of money that is being invested into keeping people going and businesses going as best as we can, and that's going to cost us in terms of how we pull that back together. We're doing this because if we don't, we could see scenes in not far off places. You think about New York City. You think about some of those places where they were overwhelmed, where you couldn't rely on phoning 911 and having an ambulance come, not necessarily for COVID, but what about the heart attack, the stroke, the broken leg, the displaced hip, all of those things. So we're doing this because we want to protect ourselves from that breakdown of our healthcare service, that overwhelming of the healthcare service. And the other thing I'd say is this is not forever. So this is a short-term piece that has done its job and is doing its job, and we will then figure out ways to start to relax it. So I think people need to step back for a second and just think about the why we're doing this and focus a little less on all the things that we've taken away, because that's often how it's presented, and think about the why we're doing this, and just look at those who can be affected, the fact that this is a virus that can lead to serious complications and even death. And I think when people step back, and most people would say, I get it. And the other thing is, it won't be forever. So I think this short-term pain allows us to make sure that we protect as many people as is possible.
Paul, very well said, and thank you very much for that. And really, thank you to everyone at home for your questions tonight, and of course to our panel. But before we go, Mr. Mayor, we got a couple minutes for you. What are some of your final thoughts before we wrap up this virtual town hall?
Well, thank you, Mike, and thank you, Mike, for continuing to do this, as well as for Cable 14 and CHML for continuing to broadcast as well. And for those that are phoning in, a new feature that we have today, thank you for tuning in. One thing I want to impart to people, as much as COVID has been an overriding issue for a lot of people in our community, and our healthcare is set up to deal with that, our healthcare system is still also there for critical health needs. And we're hearing some reports about people not calling, the proper emergency or the ambulance when they're having some health issues that they need to have attended to. So I want to encourage people to also look after your health. Even if it's not COVID, your health is important, and you need to make the call to the doctor or to the emerge or to the paramedics. If you need, healthcare, get that healthcare, because that healthcare system is not overrun at this moment. They're still doing critical healthcare issues, And you should not be ignoring your normal healthcare issues because of the COVID issue. There's no fear of going into the hospital. You should not fear that. So I encourage people to look after their health, look after your mental health as well. And we keep reminding people to call Coast if they're having mental health issues at 905-972-8338. And the Kids Help phone line at 1-800-668-6868 for kids as well. And lastly, and I know our time is short, I want to just do a shout out to our Muslim community that's celebrating Ramadan right now. Council has approved a request for the Hamilton Downtown Mosque and the Hamilton Mountain Mosque to allow for the daily call to prayers at each of those locations. So you will hear a call to prayers through the speakers and microphones in and around the mosque. So don't be alarmed. This is just a traditional call to prayer, very significant to the Muslim community. Even though they cannot get together, this will be a comfort to them to know that the call of prayer is still happening in these two locations to the Muslim community. So congratulations to them and celebrating Ramadan. And we thank everyone for your ongoing participation and continue to thank our frontline heroes. And let me just do a quick shout out to folks in the grocery stores. I was at Costco yesterday and approached by a few of them that said, why are we not getting that $4 benefit that the premier is throwing out there? And, rightfully so, they're as much a frontline service as anywhere else. And a special shout out to them today for the grocery stores, the pharmacy clerks, the Costcos, all the folks that are wearing the protective equipment and the gloves and standing behind shields, making sure that we get the groceries that we need. Shout out to them and thank you for all of their great service and work.
Well, Mr. Mayor, thank you very much. And of course, a very special thank you to Director Ken Leendhurst, our special guest this evening, who was able to answer questions about the city's efforts related to enforcement during the COVID-19 emergency. And of course, we want to remind that the city continues to accept donations of personal protective equipment to provide much needed resources for the citywide response to COVID-19. Of course, the equipment will be provided to frontline workers, emergency responders, and other healthcare professionals. The types of equipment that will be accepted, well, they include surgical masks and N95 masks, impervious gowns, gloves, face shields, and other eye protection, swabs, alcohol-based hand sanitizer, and powered air purifying respirators. Of course, the city is requesting these items from local healthcare providers, pest control, hospitality providers, nail salons, and construction companies. A reminder, homemade equipment will not be accepted. And to donate, we ask that you email ppe@hamilton.ca or call 905-546-2424, extension 2257 for more information. We do appreciate you tuning in, and we thank our panelists once again, along with our American Sign Language interpreters. We thank you for watching on Cable 14, listening on 900 CHML Radio, on the City of Hamilton's YouTube channel, or our new toll-free number. Please continue to monitor all media outlets for the latest news and updates from the City of Hamilton regarding the COVID-19 outbreak. We will be back here next Wednesday night, 7 o'clock, to answer more of your questions. I'm Mike Fortune. Thank you, and good night.